I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Oh, say, can you see by the dawn's early light what so proudly we hailed at the twilight's last gleaming o's broad stripes and bright stars through the perilous fight o'er the ramparts we watched were so gallantly streaming, and the rocket's red glare, the bombs bursting in air, gave proof through the night that our flag was still there. Oh, say does that star-spangled banner yet wave o'er the land of the free and the home of the brave.
Hello, my name is Richard Ross, and I serve as your mental health chaplain. And it is again a pleasure and an honor to be with you for this year's Mental Health Summit and to provide the opening prayer or invocation. As we gather together today, we first want to recognize, we want to pause and recognize the one who never leaves us nor forsakes us is with us. Again, whether you think of that being as a higher power, a creator, or God Almighty or whatnot, the Spirit God, but the one that never leaves us nor forsakes us, the one who is always with us, even when we may feel somewhat alone or very much alone, forsaken or abandoned, or even isolated because of what has been going on in the world and in our nation. And so as we near the end of all of this isolation and separation, we realize that the inner healing process is something that still needs to be worked on, the invisible scars, and they'll be addressed during this year's Mental Health Summit. We know about vaccines for certain things, but there is no vaccine for, of course, suicide prevention. And we look forward to working more as a team with DOD, with state and local government in helping to better our veteran numbers in those areas. May we pray together the Serenity Prayer that is so well known as we press on and prepare our hearts and our minds in beginning this year's Mental Health Summit. Let's pray together. And some may want to begin the prayer with God or higher power. Grant me the serenity to accept the things I cannot change, courage to change the things I can, and wisdom to know the difference. Amen.
Hi, my name is Gurndeep Saran, and I'm proud to serve as your Medical Center Director here at the VA Loma Linda Healthcare System. Welcome to our 9th Annual Mental Health Summit. I'm so glad you're here. This past year and a half presented many obstacles to overcome. We faced critical challenges that had to be collectively solved and encountered personal struggles in the process. There was an obvious focus on physical health and safety, but we also experienced threats to our mental health and well-being. We were tested to show resilience, our capacity to recover quickly from difficulties. While resilience is certainly an important trait for overcoming adversity, resilience and good mental health are not interchangeable. Instead, they complement one another, and both are necessary for whole health. I'm thankful that we have an opportunity now to talk about mental health, particularly from the military veteran perspective. The title veteran is often associated with words such as strong, tough, fearless, and proud. But being strong does not mean being independent and struggling with things on your own. You're not alone. It's a sign of strength to reach out and ask for help, and we're here for you. During the Mental Health Summit last year, we learned about veteran suicide risk and prevention. We addressed veteran homelessness and discussed substance abuse recovery and therapy programs available at medical facilities within VA. Our team is continuously searching for ways to expand and improve our services to providing excellent health care. We work tirelessly to fulfill our promise to care for those who have borne the battle, as well as their families and caregivers. We recently expanded access to immediate mental health care programs with mental health access clinics at the Medical Center and Ambulatory Care Center. It's our privilege to be here for the veteran you are, to meet you where you are, and offer individualized care in a safe and welcoming environment. We're grateful to work with our community partners to provide expansive care at every level. Making space for mental health conversations is not always easy, but I can tell you, it is always worth it. Throughout the years, the topic of mental health has often been shrouded in mystery and stigma, but I'm grateful that the importance of mental health has taken on a whole new meaning. Today, we are empowered as veterans, healthcare providers, community partners, just fellow human beings to share honest conversations and learn how to feel better. Improving mental health is a journey, and every journey begins with a first step. Today, you're taking a step toward better mental health and well-being. No matter how big or small, one step can make a difference. Thank you for joining this Mental Health Summit to explore the steps you can take to live a healthier life. Thank you for your service, and thank you for giving us the opportunity to serve you.
Hello, my name is Dr. Michael Batosniak, and I am the Chief of Mental Health at VA Loma Linda Healthcare System. As a U.S. Army combat veteran who served in Afghanistan and a psychologist, I am proud to lead this rapidly growing service in one of the most vibrant and diverse areas of the country. The theme for this Mental Health Summit is VA Then and Now. So much has changed over the past 75 years, and we have been lucky enough to see the most dramatic changes in VA during our lifetime. The United States Department of Veterans Affairs is the most complex and comprehensive healthcare system for veterans in the world. The Veterans Administration has provided care for veterans since the first Soldiers' Home opened after the Civil War in 1866. However, the post-World War II era saw the need to dramatically re-envision the role of VA in caring for nearly 16 million new veterans. For the first time, the U.S. military saw more casualties due to combat injuries than diseases. Improved battlefield medical care meant more service members returned home with wounds that were not previously survivable. In 1946, just months after taking over as administrator of the Veterans Administration, General Omar Bradley, along with VA's first medical director, Major General Paul Hawley, laid the groundwork for today's Veterans Health Administration by creating the Department of Medicine and Surgery. Bradley and Hawley expanded access to care for veterans during the post-World War II era and instituted a range of changes and initiatives to create what is now known as the third generation of veterans healthcare. During that time, many of the key initiatives of the VA began, which included establishing new hospitals for veterans, locating VA hospitals alongside major medical schools to promote research and innovation, incorporating mental health services and facilities into the design and operations of new VA hospitals for the first time, establishing the VA Voluntary Service to augment and complement VA's professional healthcare staff, establishing the Veterans Canteen Service to provide low-cost goods to veterans, their families, and caregivers, as well as hiring the first women doctors in VA history. Today's Veterans Health Administration, or VHA, continues to meet veterans' changing medical, surgical, and quality of life needs. New programs provide treatment for traumatic brain injuries, post-traumatic stress disorder, suicide prevention, women veterans, and more. VHA operates one of the largest healthcare systems in the world and provides training for a majority of America's medical, nursing, and allied health professionals. Roughly 60% of all medical residents obtain a portion of their training at VA hospitals, and our medical research programs benefit society at large. VA mental health has undergone a dramatic transformation since its beginnings after World War II. The post-9/11 era saw a dramatic expansion of services, programs, and staffing throughout all 139 medical centers. The VHA now offers an array of recovery-oriented mental health programs and services for eligible veterans across the country. VHA mental health programs and services have been developed to create a comprehensive array of care from acute inpatient care to residential rehabilitation and a variety of outpatient services. From a small staff of 50 in general mental health in the 1980s, VA Loma Linda Mental Health has grown to 41 inpatient and outpatient programs with close to 400 staff members. Our programs are diverse, working with homeless veterans, primary care, inpatient psychiatry, home-based care, psychosocial rehabilitation, substance use disorders, post-traumatic stress, specialty care, neuropsychology, and various forms of psychotherapy, medication management, and medical social work. We are second in the country in the provision of telemental health, and our caregiver support program is handling some of the highest volume of applications in the country. Mental health is now a foundational service at VA Loma Linda, and we are continuing to grow as more veterans seek help. As a reminder, if you are a veteran or know a veteran who needs help urgently, please contact the Veterans Crisis Line at 1-800-273-8255 and press 1 for veterans. Thank you and enjoy the summit.
Very much for having me today. I would like to express my appreciation to the organizers of this event. I know there were a lot of hands in this effort, but I'd like to give a shout out to my contacts, Veronica Fry and Raymond Espinosa. Now, every day we walk into the ACC, we see it. To care for him who shall have borne the battle and for his widow and his orphan. This is our mission, and the status quo is never good enough. We must remain vigilant, flexible, and responsive to how we can best help our veterans. And this summit is a vital part of that mission. Hi, my name is Sean Gilboy, and I'm proud to serve as the director of the High Desert Vet Center. A little about me. I grew up in an Irish-American household. My parents immigrated from Ireland to the US in the late 1950s. And raised my brother, sister, and me in the San Gabriel Valley here in California. We are truly blessed to call the United States home. And my wife and I are raising 4 energetic kids, ranging in age from age 9 to 15, I should say. Now, I've been in the mental health field for about 25 years, and I actually completed my formal training in the Army. I joined the Army in 2004 and completed 4-year stint that included a deployment to Iraq. In September 2008, 4 days before my second child was born, I joined the staff of the Loma Linda VA Hospital and served as a staff psychologist until January of 2015, when I transitioned to the mission at the High Desert Vet Center. So where do we start? 75 years. What's that, 1946? Dun, 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 dun. It's been a long, long time. When the war was over, the men and women who had been involved in uniform and in civilian capacities joined in joyous and short-lived celebrations, then immediately began the task of rebuilding their lives and the world they wanted. They were mature beyond their years, tempered by what they had been through, disciplined by the military training and sacrifices. They stayed true to their values of personal responsibility, duty, honor, and faith. The war taught them that what mattered most in their lives they wanted now was to settle down and live. Thank you, Tom Brokaw. Only, if only that was the experience of our World War II veterans. Now, while it makes us feel nostalgic for a vision of history that we want to have, I don't believe it validates our veterans' very real experiences. So over the next little while, I'm going to take us through some veteran experience through the years, and in parallel, how that informed the VA hospital and readjustment counseling services mission. So what was it really like for our World War II veterans? It's interesting. We often hear about how the Vietnam, Iraq, and even Afghanistan wars were at times controversial, filled with complex reasons as to why we were there. Reasons well beyond my pay grade. There are a lot of different things that can be said about that, but ostensibly it was a very different experience for our World War II vets, as they were part of a war effort to remove one of the greatest villains of the 20th century, good versus evil. But was their experience that much different? On a human level, those who served in World War II, unfortunately, but quite to be expected, had any number of traumatizing experiences, years without seeing loved ones, protracted combat experiences, the specter of the unknown, which included casualty rates that were sometimes 50% or higher for some pilots in the war. Imagine going out on a mission and only half return, and then doing it again and again and again. As I removed the romantic lens and the nostalgic lens, what I found was that the World War II veteran experience was very similar to the Korean, Vietnam, and global war on terror veterans. Now, the popular term in that day was psychoneurotic. Now, I think the Freud crowd was naming things back then. By 1944, the Army had already released well over 200,000 soldiers for psychoneuroses, or PN. When it was all said and done, of the 8 million veterans who saw direct combat, 1 million were released from military duty due to neuroses, a very sobering number. Now, I won't go over the features of PN because all you have to do is look up current day PTSD symptoms. But I, for one, am glad they changed the name. By 1947, almost 50% of the beds at the VA were filled with psychoneurotic patients. Divorce rates doubled. Alcohol abuse was rampant. I want to share a quote. Now, it's from a very good book by Thomas Childers called Soldier from the War Returning. It captured the experience of 3 World War II veterans. Now, I've read a lot of books, some not so great, but this I highly recommend. Again, it's Thomas Childers, Soldier from the War Returning. So well written. In the end, the veteran crime wave failed to materialize. Veterans, the public discovered, were adamant, often angry, and sometimes threatening in demanding their rights and in complaining about the frustration they were experiencing at home. They railed against the lack of jobs and adequate housing, high prices, and corrupt politics. They were annoyed with the VA red tape, especially when it came to financial aid for college. Gosh, that sounds familiar. Times change, but the human condition remains. Now, the bottom line up front, to use an Army acronym, as I explored the progression of care for our veterans in the VA, there was a resounding conclusion that came through loud and clear. The conclusion: what we do here in mental health today is not some evolutionary endpoint of technology and expertise that culminates in laser-focused interventions that resolve our veterans' woes with efficiency. What we do is show up. We show up with a strong desire to help our veterans make the best of the rest of their lives. We show up with compassion and at times grueling perseverance to make sure we are addressing the needs of the vets. We provide a caring and supportive place where veterans come to. We educate them about how their physiology and mind work. We help them fight through the programming that has them wanting to suppress and avoid. And we accurately normalize their reactions. We utilize our toolbox and spirit of caring in helping our veterans get to a place of thriving in their lives. Now, you might think that I'm referencing 2021 in those comments, and I certainly am. But in my research for this talk, it was clear that many of our providers at the VA in the 40s and 50s were doing exactly this. Now, there were some hits and misses when it came to well-meaning interventions, yet they got a lot right too. There was individual therapy that helped with emotional catharsis and working through those avoidance issues. There was group therapy where veterans realized that they were not alone. Now, fast forward to now, what we do now is stay the course. We make sure that the time distance from a conflict or the political breeze of the day, or what the internet says, don't deter us from staying true to our mission. Now, as we hit the midpoint of our history, about 35 years in, two profound things happened. PTSD became a thing, and the Vet Center program opened its first vet center. So let's start with PTSD. It became a formal diagnosis in 1980, and this was huge for a variety of reasons. The symptoms have been around, well, forever. I mean, we can go back 2,800 years to the ancient Greeks, to Homer's Odyssey, to see soldiers' pain, anger, anguish, and really disrupted relationships. Am I putting that too lightly? If interested, Jonathan Shea, a noted psychiatrist, author, and expert on PTSD, not to mention a coworker of ours at the VA from 1987 to 2008, wrote Achilles in Vietnam, Combat Trauma and the Undoing of Character, and Odysseus in America, Combat Trauma and the Trials of Homecoming. That's Jonathan Shea. He does an amazing job threading the impact of trauma through the ages with his exploration of these ancient texts. Trauma has been around forever, and the human response to that trauma is predictable and ever present. So now back to that present. Now, PTSD was a syndrome that was recognized by the medical community. That was great news for the hospitals that had something to code. And it was great news for the researchers that could get funding to research the etiology and treatment of this concrete diagnosis. It was great news for us veterans. 12 years or so ago, I was still on jump status, and I had actually worked through my fear, or abject terror, as the case might have been, call it what you will. Point is, I was embracing that adventure. Well, I embraced everything but the excruciating pain I experienced in my right inguinal area that erupted every time the chute opened, which was every time I jumped out of a plane, thank God. Of course, the treatment was ibuprofen until after my 14 months in Iraq. But then they did a pretty good workup on me. And I wanted them to find something wrong with me. Doesn't that sound weird? Well, there was something wrong with me, and I wanted them to name it and fix it. Wasn't until years later that we identified it as radiating back pain. But back to PTSD. Finally, what I am experiencing is being acknowledged. I'm not uniquely jacked up. I'm not a failure. I'm not weak. Now fix it. Well, that was 42 years ago. I met with a 70-something-year-old Vietnam vet the other day, and he said, "So, Doc, we've met several times. What's your assessment? Do you think I can be fixed?" I spent much of the session working toward a different, perhaps more complex goal, the goal of symptom relief, personal growth, increased insight, living a meaningful life. And at the end of this interaction, I had the thought, well, I think I made sense there. And the veteran, when I asked him what he was hearing me say, said, "So I need to fix myself." Now, I did my best not to make it about semantics, but it speaks to our challenge. We want to know what's broke and we want to fix it. Yeah, the answer is so much more complex than that. In some ways, it's as complex as a veteran's personality. And there is a common awareness now that stress reactions are an inevitable part of being human. Indeed, stress pervades every aspect of our lives. So it stands to reason that stress of the post-traumatic variety, that is stress that you get after trauma, would also impact every nook and cranny of our lives. As much as we love to define, isolate, and treat a symptom, and as good as that scientific method is in pushing forward treatment, it falls short in capturing what is needed to treat the stress and ailments that our veterans have experienced. They are part of the solution, to be sure, and we'll hear more about those from Ryan today, I believe. But we must go macro with our perspective. We must widen that lens. What is the context of that place where recovery and readjustment take place? Enter a seismic shift in our model of care. That was the 1970s, and many of our Vietnam vets were feeling abandoned and worse, betrayed. From their perspective at that time, no one was showing up for them. With the enduring efforts of Senator Alan Cranston of California, a World War II veteran, and a Vietnam veteran and chief of the VA, Max Cleland, along with a squad of dedicated advocates, readjustment counseling services was authorized and funded. The Vet Center program was born. Now, the combat vet had a place that they could come to that was theirs. Their post-traumatic stress was looked at as a normal reaction to traumatic circumstances, and the only cost of entry was having a DD-214, and they had an open door for the rest of their lives. They could come in for individual therapy, couples or family therapy, or any number of groups. It was a place the veteran could feel comfortable where they belonged, and it was staffed largely by veterans, if not combat vets. Now, the veterans didn't need to have service connections. There was no means testing, no hoops, and gone was the need to diagnose that could stigmatize. Gone was the need to conform to a predetermined course of therapy that had some time limit. It was and is that amazingly flexible space where we can meet the veteran where they're at and work toward readjustment at their pace toward a place of well-being, balance, and even thriving. Now, of course, I leave out the logistics and the hurdles along the way, but the end result still stands. We are 300 vet centers strong, and today we work hand in hand with the hospital and community stakeholders to care for our veterans. Now, I must tell you, I'm a psychologist who has worked with military and veterans for the better part of 20 years. And I've been trained in over a half dozen empirically validated treatments to include CPT and PE. And yet time and again, I find myself at my most effective when I am present for a veteran. A veteran will walk in distress and at the end of their rope, and I am able to sit with them, no timer, and truly be present to them. I think I do some of my best work when I keep my mouth shut. That veteran knows that I care about them. I care about what they are going through. And we get to a place where they know there is a way forward. that veteran walks away that day with hope, with realistic hope that there are better days ahead. Now, I would love to say that it's not complicated as an organization to keep it simple, straightforward, and veteran-centric, but that's what we fight for. That is our purpose. The sheer magnitude of the care that we, you and me, provide, and we veterans receive is staggering. 150 hospitals, 300 vet centers, 800 outpatient clinics. It's almost overwhelming to think of creating something so large, so comprehensive. I sit regularly on organizational meetings at vet centers and here at the hospital, and the math that it takes to make one small systemic change, wow. And here we are celebrating the 75th anniversary of this amazing system that exists for the sole purpose of caring for us veterans. How? By you and me doing our part. Now, I hear time and again, veterans, VA employees downplay or be critical of the contributions that they made. And sure, I think there was a little part of us that wants to be a superhero and save the day and change the world. I mean, as a kid, I literally was a superhero, running through the backyard, Super Sean. Now I just let the adrenaline course through my veins as I watch all the superhero movies with my kids. And I do mean all. And yet my overall contribution to our mission of caring for our veterans is very small. At the Vet Center, I manage a small staff. We work in collaboration with the CBOC to care for the counseling needs of our veterans in the high desert. It's a small, small piece of the pie. Yet, when I do what I do, and you do what you do, and we do that 335,000 times, the current number of employees at the VHA, now we've got something. What I do is very important, and what you do is very important. Everyone listening to me today plays a very important role in our mission. From our providers who choose to bring their talents and spirit to working with veterans, to our community stakeholders, all the organizations who tackle the insanely complex job of turning zeal and commitment to help our veterans into something actionable, and to our veterans themselves. Now, a funny, not funny story. And so, like I said, when we returned from Iraq, they were pretty generous with the x-rays. I was in this little waiting room at the Brigade TMC, and sitting with me were two 88 mics, truck drivers. One had deployed with me, and the other had just PCS'd in as we were preparing for Afghanistan that fall. Now, the new guy discovered that the old guy might be able to give him some advice, so he asked, "Hey, do you have any advice as we get ready to roll?" Now, the old guy, he was like 20, but I'm calling him the old guy. The old guy responded, "I'm going to be honest, you're effed." Now, he spelled it out, and I couldn't help myself. I said, "Wow, that was an amazing motivational speech." And then he turns to me, an officer sitting in that same little room, and he said, "Sorry, sir, I gotta tell it like it is." That soldier was still a victim, sucking wind, angry, feeling sorry for himself. He was at the beginning of his recovery. We all, at some point, have been hit by that Mack truck, and we find a way forward. As we make it through that recovery, many of us find it in our hearts to help those who are still suffering. Having been through trauma and continually working to make the best of the rest of your life and finding it in your hearts to help your fellow veterans who are not quite there yet. Veterans who are with me today, thank you. Now, as I take my own medicine and go through my daily gratitude list, I am thankful for my family, my health, a meaningful job, and I'm thankful that I've been given this opportunity to speak with you today, to work with and amongst you on this compelling mission to care for and be there for our country's veterans. Let our focus and effort to put our best foot forward and never waver. Thank you.
My name is Carolina Reyes and I'm a clinical social worker. Joining us today is Mr. Armin Alvarado. He is a veteran of the United States Navy and is from Northern California, and his MOS was aircraft mechanic. Thank you for joining us today, Armin. As you know, the theme for this year's summit is now and then. So let's start with the now. How would you describe your mental and physical well-being today?
I'm really stable right now, happy as well. I graduated the VASH program. Yeah. I am completely self-sufficient now from housing. 2 years from now, I graduated 2019. I'm actually doing well. I have retained a job for 3 years straight, going straight right now. It's just one of those good things that I have going on in my side, not just mentally, professionally, and emotionally, physically too as well.
Thank you for sharing, Armin. Now we know that it hasn't always been this way. Let's talk about the path that brought you to where you are today. Can we start with you sharing where you were?
It all started when I first got out of the military back in 2006. That's where I actually encountered my first homelessness when I first got out. It was just more of like I was in this crossroads path on, you know, what I needed to do or where I needed to go. I was kind of lost at that time when I first got out. I think that's really one big important too. You're trying to figure out things, life again, and you know, we were so used to having a place to go, and once you get out, you just, you know, you're kind of, like I said, you know, you're put in that crossroad and pinpoint on where you needed to go, and at that time, it's either you go straight or go left, and I went to the wayside of things, and that's when I encountered first my homelessness, and like I said, it led on to substance abuse and alcoholism as well. I wasn't able to sustain a job for like, maybe I was lucky if I reached 12 months at having a job, and this was me not having a stable place to leave as well, you know, so I was kind of in and out. And even there was one point back in 2012, it was just that I was sleeping under people's couches. Sometimes I had to take a shower in the gym before I go to work. And this is when I was trying to, you know, basically sustain to a habit that I had, which is, you know, my alcoholism and, you know, substance abuse as well. And that's when I really reached out to the VA the following year in 2013. But at that time, I didn't think I really wanted to get sober too. Maybe I was just trying to be sober just to attain housing. At that time, I believe, I know I was kind of more beating the system at that time. You know, like I said, I was just putting a Band-Aid on the things that I needed to do. I mean, I did work on some stuff with my doctor at that time, Dr. Gabriel. I worked on some underlying stuff in regards to my family, but never really got to it till the second time around. Yeah. At that point, by the time that I got introduced to you, my second time around, that's when my son was born, Maiden, as you know, at that time. But during the second time around, I had more legal issues now in regards to getting arrested as well. But I didn't do the VJA program though. I did have that again, and then plus with the CPS thing, with the custody with Aiden being born, just because I wasn't showing that I was a stable parent to actually have full custody of my son as well.
So at that time, you were still struggling with the substance
Yes,
abuse.
I was heavily struggling with substance abuse, yeah.
Okay, and the homelessness and some legal issues you mentioned.
Yeah, so it was actually more of a deeper hole than I was the first time around.
I really appreciate your willingness to share such painful and difficult experiences with me, Armin. I know it's not easy, Could you please share your recovery process, how you went from such a vulnerable, painful era in your life to where you are now? What do you think got you back on track?
Like I said, one of the things that really got me on track was as my VASH counselor at that time, you were really more involved. To me, during those time, I thought a VASH counselor, or you're my social worker, my VASH social worker. I thought at that time I treated you guys more. My first one was more somebody was just there for me to make sure that I was sustaining my housing. But this time around, I noticed, and at the same time, you were more engaged into not just my housing, with my recovery process as well. So thank you very much on that one. And what really got me on track, I don't know if you remember, is when you invited me to a mental health summit in Rialto. And during that time, when you invited me at that time, there were some breakout sessions on that mental health summit. And there was one specific breakout room that shed light on a lot of where my PTSD came from. And up to this day, I believe that's when I went to that MST breakout room. It really shed light on the things, and I think that's when I do believe that's when something really the light bulb turned on at that time. So that's why I'm really thankful for you getting involved at that time. It made me realize on what I needed to work on. And as you know, when I actually told you about it, that's when we actually got into more of what are the type of treatments that I needed to get myself into, right? And
We came up with a plan.
we came up with a plan. And the one thing that I really appreciated that I really noticed that my VASH social worker, and then plus my doctor, you guys were just working together as a unit in regards to making sure that, not just my recovery process, but just, the support group. And sometimes that's just with veterans, with PTSD or anything that we're going through. What really helped is, to have, we lost that person ourselves that sometimes we don't even have that confidence to believe in ourselves. Yeah. And when you find those people during a treatment, that, kind of instilled that, that trust that you kind of like,
We're
lacking, and the emotional support and the courage and, the encouragement. That's what I think what really helped in regards to getting me really back on track. You guys treated me like I wasn't just another vet that just came through those doors, or a number, or like a percentage. I really believe you guys really helped me there. As much as I put the work in as well, it was more of an engagement feeling on regards to my treatment at that time. Your involvement with it, with my doctor's involvement, and everybody, with Ray, getting involved as well in regards to, getting me, peer support, and getting me with the things that I needed to do, getting, and distinguishing the importance of actually taking care of yourself. I know there's people around, there's some vets in regards to the claiming process and all that. Once you were able to, differentiate, the real importance of actually just be able to heal in yourself, and then everything else will follow through after that. So, and everything the work that we've done actually paid off already. So, I'm really happy about that. I got, as you know, you were at that process when I won the full custody of my son through the courts. Got the legal process charges dropped as well. That it was just like a complete, process now and then, and actually getting, I think one of those biggest part too is, remember, and one of the struggles that I went through was being in the VASH program. I just felt like I felt like I was just sitting and, waiting for things to happen for me. And, we were able to recognize that that's not the person who I am. And, I was more of a go-getter type. So, as you know, that's one of the behaviors that I actually changed and stuff. And up to this day, I couldn't believe that I was actually able to sustain and graduate housing the right way. And if you look at it, 2 years running now, graduate from the VASH program, self-sufficiency, and able to sustain a self-sufficient housing for the past 2 years ever since I graduated. So, and I know it has a greater deal on one of the biggest things, the biggest factor on attaining that is, employment and sobriety, definitely. Sobriety, employment, and just staying in touch too as well.
Everything starts to fall into
Yeah,
place.
exactly.
Yeah. Well, congratulations, because these this shows that recovery, it's not always a straight line. There's ups and downs, and you were a person who never quit. And it's an honor having you here with me again today. It was an honor serving and working with you.
Yes.
And, couldn't be prouder of you.
Yep.
Where do you see yourself within the next 2-3 years?
Hopefully, I have in my career, on the work that I'm doing right now. Hopefully, I'm able to grow more into that. Maybe go more of on the management side of it. So that'll be good. And just raising Aiden, right? My son. Build a family. Those things that I push aside at those times. I do. During those times in the process of those hardships that I have, I know I pushed away a lot of my loved ones, and so now it's just all about it, maintaining that and building another family. That'll be good. Sustaining that, maybe home ownership as well. Hopefully, in the next 3 years, that will actually be one of those things that I wanted to achieve. So
Wonderful.
Yep.
Wonderful.
So I just want to reach out to my fellow veterans out there. I just wanted you to know that, the things that I went through, it was really a hard process that I went through, but the amount of work that you have to put in, I can't just explain to you guys the rewarding feeling that you have once you reached out to it. I didn't start the program perfectly. I was playing that my sobriety like it was a game. My mental health at that time was, wasn't completely there. So all I ask you guys is just, reach out to the VA, take advantage of the programs that we have over here. Stay engaged with your social worker, stay engaged with your doctor, create a great plan that works out for you guys. And I'm telling you, it's just the opportunities and the stability, the emotional and mental health that I have right now. It's not perfect, but it's better than where it was before. As long as it's better than where it was before, I'm perfectly fine with that. And that's where I'm happy. So thank you.
Thank you, Armin. Thank you. Thank you for sharing, Armin. Your story is truly inspiring. Want to thank you for your bravery and your courage to share with us today. By sharing your story, I know that you're helping a veteran and veterans that could be facing today the very exact same difficulties and struggles that you faced many years ago. And to hear your story is again truly inspiring.
Hi, my name is Billy Sackett. I hope you're enjoying this year's Mental Health Summit. Thank you for being here, and thanks to everyone who worked so hard to put this together. I've been a social worker with the VA since 2004, and I was a social work intern at the VA before that while in graduate school. I've been serving as a mental health supervisor for the last several years, and helping to build effective team-based programs is something I enjoy and take seriously. I will say a few words about the programs I supervise. MICM, or Mental Health Intensive Case Management, was established as a program in Loma Linda in 2005. MICM is an interdisciplinary team of mental health providers who go into the communities and homes of veterans with serious mental illness to help them with challenges from A to Z so they can progress in what's important to them, their goals, so they can regain their place in the sun within their families and communities. We started with one social worker in MICM in 2004. Now, we have 5 social workers, 2 registered nurses, 2 occupational therapists, a peer specialist, a pharmacist, and a psychiatrist. We also work closely with our mental health chaplain, our recreation therapist, and vocational rehabilitation. Earlier this month, we earned our second 3-year accreditation from the Commission on the Accreditation of Rehabilitation Facilities. How does a veteran get into MICM? Referrals are made from within the mental health service, and we also work with our community partners, such as the National Alliance on Mental Illness, or NAMI, to help ensure veterans who need MICM get connected. In addition, we screen all veterans who are hospitalized in our inpatient psychiatric unit for the program. Another program I supervise is the Psychosocial Rehabilitation and Recovery Center, or PRRC. PRRC was established in 2011 and now has 8 regular mental health positions, including social workers, psychologists, and a peer specialists. They work closely with our mental health chaplain, our recreation therapist, and our psychology trainees. In December, PRRC achieved its third 3-year accreditation. PRRCs are intensive outpatient specialty programs that support veterans in their recovery from mental illness by helping them to integrate back into their families and communities with meaningful, self-determined roles. PRRC has one-to-one psychotherapy, education groups, group psychotherapy, recreation therapy, spiritual care, links to vocational rehabilitation, and more. PRRC has 2 treatment tracks. The first track, which we call CORE, is an intensive outpatient program for veterans who are duly diagnosed with a serious mental illness and a substance use disorder. This track includes a 90-day housing component for eligible veterans. Veterans can be referred by any provider in mental health. They can also call into our readiness group when they are interested in addressing a dual diagnosis through the CORE track. A lot has changed since I was first hired at the VA. Mental health providers are now integrated throughout the VA Loma Linda healthcare system and its satellites in order to reach as many veterans as possible. As more veterans engage in services, the stigma regarding mental health has decreased as more and more people recognize that engaging in mental health treatment is a strength and not a weakness. We also have more data to illustrate the effectiveness of mental health treatment. As the size of our service has grown, so has our expertise, our years of experience, and the diversity represented by our staff. We have been trained in a variety of therapies or modalities that have been shown to be effective for helping veterans with depression, anxiety, trauma-related disorders, substance use disorders, serious mental illness, psychosis, personality disorders, and many other problems. Programs have developed to effectively deliver these modalities to veterans who need and want them. For example, our suicide prevention program has innovated in multiple ways to meet the needs of veterans who are at risk for harming or killing themselves. They have specialized therapists, specialized groups, specialized metrics, and specialized performance improvement projects. They also have peer-led outreach into the communities, rural and urban, in order to more literally meet veterans where they're at. The work they do and how they collaborate with our community partners has been essential. One of the most significant changes over the last few years has been the growth in those partnerships with our community stakeholders, with our Mental Health Advisory Council, and with other agencies or organizations or groups of people who care about veterans. In recent years, the Veterans Community Outreach Team, VCOT, was developed as part of our pilot project in response to the Clay Hunt Suicide Prevention Act. VCOT is where the VA and our community partners now meet regularly to share information and support veterans. This creates a web of services critical in reaching hard-to-reach veterans and getting them connected to the right place according to their needs and preferences. If we can engage veterans in care and keep them engaged, we can reduce veteran suicide. In addition to the VCOT located here in Redlands, we also now have VCOT satellites in the high desert and in the Coachella Valley. What's more is that our VCOTs are led by our very own peer specialists, and who better to lead these groups than veterans who themselves have had to navigate the complicated web of services. Mostly, I think what I've observed over my years in mental health here is a growing commitment and sense of teamwork in meeting the mental health needs and preferences of the veterans we serve. This was essential to our ability to adapt to the pandemic and to continue providing the services we're committed to providing. I'm so proud to be part of the work we're doing together to serve veterans. Thank you again for being here.
Welcome to the Veterans Panel. My name is Carolina Reyes again, and I wanted to introduce you a very special guest of honor we have here today with us, Mr. Aaron Pratt. Thank you so much for taking the time to meet with us today.
Thank you for having me.
I appreciate it. So as you know, the theme for this year's summit is Now and Then.
Yes.
Would you mind sharing with us what's going well? How are you doing today?
I'm thriving right now.
You're thriving.
Amid COVID, I'm thriving. I've revamped my nonprofit, SCARP, Second Chance Alliance Reentry Program. I've been promoted to supervisor at my job, where I'm a substance abuse counselor, behavioral health therapist. Behavioral health technician. You guys are the therapists. But anyway, I'm stable in my housing. My credit score went from 395 years ago to 802 today.
Congratulations.
And I'm showing others how to overcome those barriers and challenges in the work that I do with my nonprofit. I've accepted the fact that I'm okay alone. I think that's a milestone, because losing my wife and then having to accept moving forward without her, I call that an accomplishment, because I wasn't really feeling like I could move forward until now. So I'm doing well. I'm thriving.
Thank you for sharing.
You're welcome.
Now we know that things haven't always been this way. Could you tell us when you hit a point in your life when you knew that things had to change? What were the struggles that you experienced?
So I was sleeping in the back seat of an unregistered car that didn't belong to me. I was going to school on a cell phone that I would have to find electricity to charge up every day to meet the deadlines of my academic desires and wanting to achieve success. I was hungry. I was addicted to several things. Alcohol. I participated in lascivious behavior to survive. it wasn't easy. It was a mess. I didn't have a way to clean my clothes. I didn't have a way to clean myself. And I was totally devoid of any passion or any motivation. I had checked out. I lost insight. And that right there should describe a lot to someone who's out there being able to identify with what is insight, a lack of desire to live, a lack of desire to participate in normal human behavior activities. I was no longer a thriving, living organism equated to be a human being. That's how horrible it was. I was demoralized, and I had checked out. Yeah, and prison became my home. I wound up doing 10 years one time. I did 3 years, and then I did 3 more years, so a total of 16 years in the system before I got my life together.
Thank you for sharing such a difficult experience.
And that's as a veteran. Yeah.
Yes,
Yeah.
Mr. Pratt, do you mind sharing or telling me more what led to your incarceration?
Yeah, so I've had great jobs. I worked at Northrop, Lockheed, Martin Marietta. I even opened up my own engineering firm right here in Temecula, California, for about 3 years. But I was undiagnosed when I came home. I was left to my own demise. I didn't know I had mental health challenges. I didn't know why I behaved like I behaved. I didn't know why I had angry outbursts. I didn't know why I was anxious all the time. I didn't know why I couldn't take direction from people of authority. Mm-hmm. I didn't know why I didn't like people in uniform anymore that represented authority. I was undiagnosed. And without that information, I gave up 16 more years of my life to live in a 5x9 cell alone. So that's what happened. It wasn't the drugs, everything that I participated in was because I didn't have the information about my symptoms, about my negative behaviors, that I didn't know anything about triggers. I didn't know anything. I just behaved in a way that was not human to cope. Those were my coping mechanisms. Hurting other people. You know, you heard the adage, hurt people is real. And until I became educated about what was wrong with me, I hurt people.
Thank you for sharing. No, I appreciate your willingness to share with us today what those moments represented to you, and the insight that you have now to be able to discuss and share this with others is very powerful, and it's very inspiring.
Thank you.
Because this is where you were then, and we just we're talking about where you are today now.
Right.
So it's truly inspiring.
Thank
So I really appreciate your willingness to share something so difficult. How did you go from such a dark and painful time in your life to where you are today?
First of all, it started with my faith. Being locked in that cell, 23 hours a day, 1 hour out, I had nothing else to hope for. Key word, hope for. But I was raised in a polytheistic home, and I chose to believe in the God that I serve today. And that God saved me from myself, gave me the ability to complete my time, my sentence, kept my mind healthy, and he opened up an opportunity where I met a guy in prison that was a veterans liaison. That guy changed the evolution of my life. He did an assessment. The assessment defined what was wrong with me, and I began to get educated. From that education to getting out, I had to take the due diligence after being paroled. This is the key that I want every veteran to get a hold of. Once you get the help, you need to participate. You need to have the wherewith to say, I've identified the cause, now let me get my why. I need to find out how to get my why. I found the resources to help me achieve my why. And that began to open up a whole new life for me. My eyes were bright, my mind was clear, and my heart was fashioned with determination.
Your outlook on life
Yes.
was completely transformed.
Transformed, yes.
So when you were in prison, you said it was your faith
Yes.
that really strengthened you, gave you the strength and the courage that you needed to face what recovery would be, knowing that you weren't alone. How this was just your past that allowed you to reach out to your faith. What connected you from your past to your faith during that time while you were in jail?
Well, you know, my mental health conditions, they work in a different way for me. For some people, remembering past events creates trauma. For me, it creates motivation. And I remember growing up in a home where my dad was Muslim, my mom was Pentecostal. I had to remember how to discern truth. I found out my truth was my mom's belief. And I began to miss my mom, who passed away while I was in Beirut, and I didn't get to come home. So when I started missing her, it activated confidence in me to rely on my faith, because that's how I made it home. Keeping my faith.
That
listening.
was the connection.
That was the connection. Yes.
Thank you. That's
Yes.
what I wanted to know. Thank you. That's incredible. Incredible. Is there anything else that you want to share to veterans that may be listening today who are in that despair, who are feeling alone, and perhaps haven't yet met that person, like the person you met that was while you were serving, while you were in prison?
Yes.
Who opened the opportunity for you to understand what exactly was going on with you?
I'm going to speak from a place of knowledge and remembrance. It's before I met that guy, sitting in the degradation of dehumanization. I was not human. I was not human in the way I thought. I was not human in the way I behaved. And I was sitting in that cell and I said, there's got to be something better than this. And I remember, you were a 4.0 soul. You were a 4.0 sailor, Aaron. You need to be a 4.0 human being. And I asked myself, why? How do I get there? And why am I here today? If there's a veteran out there today, you sitting in your symptoms, and you know it's not natural. You were not created to be homeless. You were not created to abuse substances to stuff the reality of your pain. You were not created to do nothing. You're still a soldier. Get your gig line straight. Suit up, show up. Go to the Veterans Administration. Go to RUHS, Riverside Behavioral Health. Go somewhere and get help, but don't give up. There's help out here. And if you know my name from this video, you can reach out to me. I've acquired a lot of resources. I want to help you. Helping you is my RX for healing.
Thank you, absolutely. Could you tell us the name of your nonprofit organization
So
again?
the acronym is SCARP. It stands for Second Chance Alliance Reentry Program. Specialized, I revamped the whole thing. I went from youth, at-risk youth, formerly incarcerated adults. I'm focusing primarily now on veterans with co-occurring disorders. I'm focusing, I'm still dabbling in the other areas of mental health, gang initiatives, gang violence, family dynamics. I'm still dabbling in those things with partners. But my main revamping of SCARP is for the co-occurring veteran who has forgotten how to live.
Beautiful, thank you. We appreciate your bravery, your honesty, and allowing yourself to be vulnerable for us today.
Yes.
Again, it's a truly inspiring story, and I just want to really appreciate and thank you.
You're welcome.
Hi, my name is Karen Baer. I'm the coordinator of the HUD-VASH program here at VA Loma Linda. I've actually been here at VA Loma Linda for the past 15 years. I started out here in 2006 in the Addictions Treatment Program, now known as the STAR program, before I came over here to the HUD-VASH program in about 2016. So I'm here to talk to you today about HUD-VASH and what exactly is it that we do. Well, we partner with HUD, the Housing and Urban Development, and the local public housing authorities to provide Section 8 housing vouchers to veterans who are experiencing homelessness. We have an interdisciplinary team. There's actually about 52 of us all together, and we have social workers, RNs, LVN, peer support specialists. We have social service assistants, program support assistants, and employment specialists. So with this interdisciplinary team, we work together to house our veterans who are experiencing homelessness. And when I first started in 2006 with the Addictions Treatment Program, there were about 20-ish HUD-VASH vouchers and just one social worker. And we've gone from just that one social worker and 20-ish vouchers all the way up to today with 52 staff members dedicated to the HUD-VASH program and over 1,200 HUD-VASH vouchers. One of the things that is brand new from when I first started as the coordinator in 2006 for the HUD-VASH program, we didn't have any what's called project-based housing. Currently we have 3 project-based housing sites. And basically what that means is that it's a housing site that's dedicated to serving the veterans that are in the HUD-VASH program. We have staff on site and we house approximately 200 veterans at these 3 different sites. One is in Moreno Valley and Beaumont and here in the city of Loma Linda. We actually have 4 new sites that are in development. There are going to be 2 in Riverside, in the city of Riverside, and there is 1 in development under construction already out in Cathedral City. And there's also 1 that is beginning development in Redlands. It takes many, many years to get these project-based sites up and running. I was working with the site in Redlands just the other day, helping them get the documents that are needed for funding, and realize that this is actually a project that I've been working on since 2015. So it is something that takes a really long time to get moving, and a lot of money to get them going. But one of the things that we have found is that veterans do better when they are living with other veterans. And so, you know, like I said, we have our staff on site who are able to provide the case management services to those veterans. Another thing that's new since I came on board here in the HUD-VASH program is that we have what's called coordinated entry system in both counties. It used to be that if someone was experiencing homelessness, whether that was a civilian or a veteran, there wasn't really a coordinated approach to how that homelessness was addressed and ultimately resolved. Now, in both San Bernardino and Riverside counties, we have what's called a coordinated entry system. And we work with the counties every single week to help identify who those veterans are that are experiencing homelessness. A few years back, we actually met the federal benchmarks of ending veteran homelessness in the county of Riverside. And we've been able to, I'm very proud to report that we've been able to maintain that. Over the past year, despite COVID, in the county of Riverside, we've kept at about 30 veterans who are identified on the by name list, which is a list that identifies every single known veteran in the entire county who's experiencing homelessness, the agency that's working with them, the long-term permanent housing plan, and where they are in that process. And we've been able to keep that at about 30. So as veterans enter homelessness in Riverside County, we're able to identify it and resolve it within that 90-day mark, which is the requirement of ending veteran homelessness. I'm also happy to report that in San Bernardino County, about a year ago, we were around 150 veterans who were experiencing homelessness who were identified on the by name list. As of 1 week ago, that number had gone down to 55 veterans who were experiencing homelessness. This team is very dedicated to the mission of ending veteran homelessness and is extremely creative in their approaches. And despite COVID-19, I'm really proud to report that we've continued housing our veterans and continued to work with landlords on identifying available units and how to do that in a safe manner. In fact, in 2020, we housed just shy of what we did in 2019. So it was about approximately a little bit under 200 veterans who were housed in 2020. And in 2019, it was about 200. So we haven't let COVID-19 slow us down at all. And like I said, we're always looking for new and innovative ways to serve our veterans. And I can't think of any greater mission than what we do here in HUD-VASH, which is to help our veterans find a home. Especially this past year, I think that home took on a new meaning in that, I remember exactly where I was when the governor of California made the stay-at-home order, and all the fear that I felt and the trepidation and being in healthcare, I knew what that meant. You think about it when you're not feeling well, where do you want to be? When you've had a terrible day at work, or you're just exhausted, or perhaps you want to see your loved ones or the possessions that you value more than anything else in the world, where do you want to go? Where are those things and those people? They're at home. And the veterans that we serve don't have that. And so for us here in the HUD-VASH program, it is our great honor. It is my great honor to serve as the coordinator, to work on housing our veterans who are experiencing homelessness. I personally don't think that any veteran, especially a veteran, but I don't think anyone, but especially a veteran, should ever experience homelessness. And so it is my great honor to work here in the HUD-VASH program and to talk to you a little bit today about what it is that we do here. And if you happen to meet a veteran who is experiencing homelessness, please let us know, let me know. We're here to serve, and we want to make outreach to that veteran so that we can help them as soon as possible. Thank you very much.
So since last year's summit, a lot has happened. There's been a lot of life changes from me. So last year when I participated, I was a recent graduate from the University of California, Riverside. I was seeking employment. I ended up getting a part-time job during the pandemic, right? And so also because of the pandemic, I was transitioning. I moved from the Inland Empire to Chicago because of so much uncertainty going on. And I ended up getting a position at Northwestern University part-time. So that was great and exciting, but I really was seeking something full-time. And I was also trying to adjust back, to Midwest life. I grew up in the Midwest, but I was in California for 12 years of my life, so I got pretty used to that. I was also doing like telehealth. So I was really just trying to keep in touch with my therapist, and also trying to reconnect with the VA out here, the VA facility, to get services. And then since then as well, I actually am starting a new full-time job in a week. So I finally, after struggling during the pandemic for a year to find full-time employment, I finally got there recently. So it's a lot of changes. Definitely where I see myself going in a year. Hopefully I'm still going to be in this new position as a research analyst. So I'll be working more in the criminal justice system. And so I see myself continuing to work here for at least 2 years, and then possibly switching to another research position or another data analyst position. But I would definitely like to continue my work and treatment that I'm receiving through the Veteran Resource Center, either out here in Illinois and Chicago, and also continue seeking services with the VA, because it's very easy for me to just, when things are going great, it's very easy to stop and think like I'm okay until I, something bad happens and then I hit a wall or something. But to just be mindful of receiving services even when things are going well, because a lot of changes for me cause a lot of anxiety when there's like multiple things happening at once, which is happening to me right now. I mean, even if it's like great things, right? Like I have to move, I have to relocate, trying to find housing with a pet, and that's affordable, that can be a struggle. And relationships, I've been living with my family for the past year, and that's been both fantastic and also draining at the same time, right? So I think with a lot of veterans, we go through treatment, we go through our internal struggles along with family members sometimes, and sometimes they can exacerbate or make things better. And with mine, I feel like it's a bit of both, right? I have to try to navigate setting boundaries with my family, and also kind of, letting them know I'm going through something, or I went through something, and I need you to give me space, or I need you, to work with me here. And yeah, so keeping those lines of communication is definitely something that I'm striving to do in my personal life. I've really tried to think of it in a holistic process. So I mentioned being in touch with my therapist, and she really encouraged me to set myself up with the VA, because that was something I was putting off. Like I was like, I don't have anything physically going on, like I can put that off. So she was really instrumental in pushing me to, get my appointments in, doing checkups and all of that. Also just talking about what was going on. Sometimes I would think that, things are going well, but there'll be underlying issues that I am not conscious of. And so in talking to her, some of that stuff comes out, and I put into more concrete and more understandable ways of understanding what's going on with me internally. So I think keeping that relationship, as well as trying to balance my friendships when I moved, I felt like I was really sad because I worked so hard to establish really good friendships in California, and I felt like I was starting over. So keeping in touch with those friends, I letting my partner, my romantic partner, know that, what I was going through, and so that he could support me and have an understanding of, I'm struggling because I don't have social networks of friends like he does out here. So he would, have a better understanding and give me grace for when I was, not feeling too good. And then also physically, I think for me, as someone who struggles with anxiety and all these other issues, being in a fitness course, like once the pandemic kind of slowed down and they opened up gyms again, like I sought out some intense workout programs. So I ended up joining a boot camp, and as a vet, that's like, to me, that's like everything. I like the challenge. I like being physically fit. It keeps me focused. I just feel good, every day, just being challenged physically. And so that helps me with my mental health, right? Like I get my workout in, my intense workout in the morning, and I'm like, I've done this before. Like I've been through boot camp, so this should be a piece of cake. It's not, but it's still very helpful. It's still very helpful to me on a daily. Like I feel accomplished at the end of the week, when I've gone to my classes 3-4 times a week. It helps my confidence too. So I've really also focused on my physical well-being because I kind of got like in a slump during the pandemic, as I think a lot of us did, the extra weight gain and the sitting at home and not knowing what to do. So I've been really trying to overall focus holistically on my relationships, my mental health, my physical well-being. But I think the hardest hurdle was the career choice. I a lot of times I question myself, like, am I not good enough to get a full-time job? Do I need to go back to school again? Do I need to get a PhD? Like, why am I not getting called back? Why I would go through rounds of interviews and then get a no. And so I was really just I think it's easy to focus on the negative, and which is what I was doing. I was like, what is wrong with me? Am I not, I'm not like I can't get hired or something, like. And I think talking that out with my therapist was really kind of eye-opening, and because again, we can get stuck in the negative and look at all our just look at our faults or where our weaknesses are and not look at our strengths. And so I think I was focusing a lot on that, and talking that out was really helpful. It's a lot of work, to be honest. It's a lot of work to try to look at every aspect and be holistic and be like, I need to do this, I need to do that. But I would say it's worth it, right? Because if I didn't talk that out, or if I didn't, talk to my friends or my partner about what was going on and my frustrations, I think I could easily, go to a darker place where I'm not getting help and not, realizing that I'm just talking myself down. So that's what I've been really doing to maintain. Most rewarding part about my career choice and move, I think, has been definitely getting the opportunities I've gained. Like, I know I complained a lot internally about my part-time position, but I was like, I got a part-time job at Northwestern University. Like, when I was a teenager, I dreamt of going there one day, and I was like, now I work there and I have some pretty good connections with people that have also been great. I think the team I worked with, although I only met them a handful of times in person, they were like, I think I couldn't have had a better small team to work with via Zoom for the past year. And although it was part-time work, it was honestly sort of relaxing because I still had time to do other things and get other, things accomplished throughout the day. So in hindsight, it was amazing. I just was stuck in the negative sometimes. So unexpected barriers that I encountered, I would say that when I moved here, I thought I was going to be able to, live with my family for 2 to 3 months and move on. And it ended up being a little over a year that I've been living with my family. So that includes both my parents and my sister and my niece. And I was just thought I was going to go crazy. Like I was just like, I can't do this. But then I was like, well, I don't really have too many options right now. Like just my, the pay, like I was stuck. I felt stuck and I didn't expect that at all. And I had told my friends from California, like, yeah, I should be able to get a place, in 3 or 4 months and you can come visit me, no problem, once the pandemic eases up. And that was not the case. And I haven't had my own space for a very long time. And I just, as a grown woman, I just felt like I was going crazy. So I've had to really navigate that, that unexpected part of moving for the past year.